everyone, and welcome to the Babies in Common show. I'm Jeanette, the owner of Babies in Common and an international board-certified lactation consultant and childbirth educator.
And I'm Melissa, a longtime maternity OBGYN nurse, breastfeeding counselor, and childbirth educator. Welcome, listeners. Please note that any information shared during the show is not to be taken as medical advice. Please consult your own care providers for questions about you or your baby's health, and visit babiesincommon.com/disclaimer to read more.
Awesome. Today is Wednesday, January 6th, 2021, although for our guest, it is already January 7th. Our guest today is Yasmin Effath, and she's an IBCLC-lactation consultant in private practice in Mumbai, India. She's also a biodynamic craniosacral practitioner, international speaker, and filmmaker. After listening to our show today, if you'd like to learn more about her and the film that she made, you can visit her website, nourishandnature.in for India.in.
Yes, we are thrilled that you said yes to joining us now, especially since it's 11 hours ahead of our time. We're filming in the evening, but you are filming at the crack of dawn. So thank you so much for getting up early today to talk with us.
Hi, and I'm so excited to be with you all today, and I feel honored to have this interaction. And time difference isn't really anything that comes in between. And thank you for accommodating all the time, in terms of just getting to know about the film and just, feeling so connected across the world about issues that feel very similar in experiences for all of us. So thank you so much. I'm very excited to be with you all today.
All right. So, Yasmin, I think I heard about you before the movie came out, but definitely now your work is much more widely known in the lactation community and celebrated too. And both Melissa and I have now seen your film. It's called Untying Breastfeeding. And the way the movie is described, and I'll read it, the description that you have. Untying Breastfeeding is a 59-minute documentary which investigates the narrative of the women who navigate through significant breastfeeding challenges due to the congenital birth anomaly called tongue tie, and trace the arduous process of them encountering medical professionals who often have a dismissive, denigrative, or prescriptive approach. The narrative is juxtaposed with 16 experts from across the world who share the latest understanding and research about various factors and events that sabotage birth and breastfeeding. And these factors and events potentially have lifelong implications for the health of humankind, which is really, really deep and profound. And I love the way you talk about that. So first, let's start with you. So you're an IBCLC, an international board certified lactation consultant in Mumbai, India. And so what's your practice like? I know you have an office because it looked like your office in the film, but do you do home visits too? Do you work in a hospital? Do you work in a doctor's office, dentist office? Tell me about what your practice looks like.
Well, I think organically, the way the practice developed is I did consider working out of a hospital because I felt like most of the parents will require help as immediately as possible, so we can kind of not have the journey of the difficulty that usually does occur for several weeks after birth, right? But I also consciously didn't get into a medical system or a system where birth is occurring, especially in cities like India, major cities like India, because most of the births are institutionalized because the government has been working, tirelessly to get people to actually have birth in the hospitals. So this has been the policy that the government of India has been putting it through. But I chose not to get into the system because much of the support that's around the birth is not conducive to having a great start with breastfeeding. And I don't think it's centrally to do with India particularly. I don't think it's uniquely a situation in India, but I think it's across the world. And that started to reveal itself while I was making the film and talking to different people all across the world. And I felt we all had very similar stories. We had
So
very
true.
similar experiences, and sometimes uncomfortably very close and intimate in those experiences. And similar attitudes towards how the birth support should be, So I chose not to be in a medical system, and I felt like a private clinic would be a better option because I needed to choose if I'm going to put my work or my time towards having to navigate through the policies of the hospital, or would I put all my attention towards the intensive care that I needed to provide to breastfeeding mothers and families. So
Right.
therefore, it was a chosen private practice. And as you saw in the film, I had a clinic. Of course, this year has been a little difficult, so I had to give up my clinic during the COVID times. But it was a space that was more like a home, and we had parents who would come, and there were some of those cases that I had almost as if there was an intensive care space for breastfeeding mothers, an observation for about 12 hours a day, sometimes 10 to 12 hours a day.
Oh, wow.
Because
Wow.
That's such an interesting model.
I felt it was very important, because the number of visits they would otherwise make would be would just prolong the difficulties for some mothers, and just having them observed through maybe about 4 or 5 feeds made a huge, massive difference to those mothers.
That just gives me chills. I've literally never heard of anybody.
I haven't heard of that either. I think that's fascinating.
It's brilliant. I have to think about that. Melissa, remind me someday if we get another office, like we need to think about like a bigger office with another room where they can hang out with each other and TV and all that. Yeah.
When you say lactation clinic, that's exactly what you're describing. That's wonderful. And I also love how you describe your work. You say it's to preserve and support the relationship between mother and baby. And I just love that. You started your work based on your own experience of birth and breastfeeding, like many of us do. And you did share that in your documentary. Your baby didn't take your breast early on. And then, as you described, it hurt every time. It was very painful. Even though you managed to nurse through the pain, for 2.5 years, it was painful every time. So what was going on there, and why did you keep going? What helped you persevere?
Yeah, I don't see myself as being uniquely set in a space where breastfeeding can be difficult and then we drop off. I think a lot of mothers do drop off, but a lot of mothers still go through as well. And if you ask me what keeps you going there, I guess it's maternal instinct. And sometimes you set yourself on a journey. You feel like no matter whatever the difficulty, you want to do the best. And that's the only thing that keeps guiding you and moving forward. Especially me back then was not a very informed mother. I never went to classes, I never did childbirth classes, or I never really read up a lot at all. So I was as a naive mother who went through a pregnancy and birth and breastfeeding as a natural process of life. But then I guess through the process, I started to have bodily experiences of, sensorial experiences that have deep imprints in me, especially of the birth, because it was a cesarean section, because it was also a high-risk pregnancy. I had 2 miscarriages before that. So I was categorized to be in the high-risk, birth. And so they took no chances and they didn't want me to go through labor. So they chose to be an elective cesarean section. And even though it was a planned event, and I still had experiences that it took me several years to kind of process that in my body and mind.
Sure.
Being in front of a lot of people in the operation room, they touch without consent sometimes while they're doing their activities, whatever they were preparing for the, surgical procedures. And just the fact that I felt so disconnected with my baby had a very deep imprint in me, a very deep experience that I needed to kind of process somehow. And then moving from there, breastfeeding wasn't going easy as well. It was extremely painful. And there was no one who could actually help me out with. I did go to, pediatricians, as everybody does. And all they would say is, can you just put the baby onto the breast? And they would watch me feed for about less than 15 seconds and they would say, everything looks fine.
Right.
Based on what reference, right?
Based on what reference, yes. Yeah. And I did have a little interaction later on once I became a lactation consultant. A pediatrician who was also a lactation consultant. I felt it was a fantastic combination to have. But she called me up and she said, there was one of your clients who had come to me, and I believe you mentioned that the baby had a tongue tie. And she said, I watched the baby feed and everything was fine. So where was the problem? So
That would be like
you know,
inside the mouth, not the part you can see,
yeah,
but
exactly. So I said, did you ever ask her how she felt about breastfeeding?
Right.
Yep.
I mean, just as basic as that, it seems to be such a difficult thing. So I was sitting there as a mother trying to latch my baby, and my baby did latch, because people forget the latch as actually has several aspects to it, not just attachment to breast.
Right.
I think we think that latch is okay or not okay depending on whether the baby is going to the breast at all. You know, a lot of babies do attach to the breast, but what do they do after? That is
Or how
a
much of the
mystery.
breast, how much of the breast are they attaching to? A lot of people are like, oh, my baby latch is fine. And then I see, and I was like, that's like a nipple feed right there, you know?
Yeah. Even if it looked totally fine,
Right.
it's not the experience of what the mother is going through, right? So I was clueless and I was confused. I felt I felt inadequate as a mother. I felt like maybe I was doing something wrong, you know? And my baby wasn't growing well either, because she wasn't getting all the milk that she needed to. So those experiences really took me into a completely different journey in life. And also then what helped me through that process was a moral support that I got from La Leche League. And I love that organization. I'm also an active La Leche League leader since then. But it was something that really kept me supported, at least, keep going, it's okay. Sometimes things can be difficult. So, while they could not give me clinical support, they did provide they did provide the love and support that allowed me to kind of go through the process. I felt that way.
Are there other IBCLCs in your area?
Oh, there are lots of them now.
Okay.
Back then, they were much, much lesser.
Yep.
But I don't think we have many as per the population of India. No, there's a huge gap, huge gap.
Right.
Yes, but there are a lot of lactation counselors. Traditionally, I think the lactation was and still is primarily the support that's provided from the nurses. We don't have nurse practitioners, but just the general nurses that are there in maternity wards. Those are the ones that would support if they needed to support.
I have a funny story for you. So when I was a kid, I had a very active imagination, and I don't know how I came up with this story, but I used to tell this story that I had an identical twin on the other side of the world in India, whose name was also Melissa. And she was exactly like me, except she was brown and I was white, and she was in India and I was in America, and I had this imagination. I feel like right now your story is my imagination coming to fruition for thousands of women around our country who are listening to this podcast, being, wow, someone just like me on the other side of the world. I mean, the things that you're talking about are apparently universal. Feeling like, the way we birth, the way we nourish our babies, the way we get pregnant is somehow tied to something deep in our souls. The not being heard and listened to by medical providers, the needing of support from other experienced breastfeeding women that helped you, even if not clinically, but emotionally and spiritually through your journey. It's universal. It doesn't matter if you're where you are in this world. It's a universal experience.
And the part that you said too about when you go to your pediatrician or this colleague that's a IBCLC and pediatrician, that and in your film you talk with Dr. Agarwal and who's in Arizona here in the U.S., who I've heard a lot about from colleagues. I have a lot of colleagues in Arizona as well. And then Dr. Lafort, who's a pediatrician in Auckland, New Zealand. And, they're talking about like, well, pediatricians are trying to do the best that we can do, but they don't receive the education. So that's the same thing. And most parents do not know that pediatricians and nurses and midwives don't get that much education, when especially pediatricians and family doctors, they should be the ones that are getting some education. And so they're not, and they don't even know sometimes who to refer to. Right? And you're finding that's the same thing where you are. Is that still the case, you feel like, in 2020?
Oh, yeah, I guess so. Yes, it's still the same, because when we started the organization, that there are only primarily 3 organizations that got started, that was professional organizations that support understanding about tongue ties, especially tongue ties, which we're still going to be talking about during our chat here, which is like the Australian Association Society for Tongue and Lip Ties, and then the IATP, the International Association of Professionals for Ankylosing. So, and ICAP, which is also something that we co-founded together. These three organizations don't have many pediatricians at all.
Right.
And that's interesting because whenever we had conversations as well as conferences across the world on this subject or any issues that were around breastfeeding, I think it's the number of pediatricians that are involved as very less still. Very less still. So we would see more of IBCLCs coming in on board, or maybe other people who might be interested, like midwifery. Maybe they would probably be, because the model of midwifery actually is brings in the aspect of deep listening. So I suppose they feel drawn towards it a lot more than other people do. But as a medical as a medical team, I think, like you mentioned, when you watch the film, you realize that a lot of people did acknowledge, like Dr. Agrawal did acknowledge, that there's zero knowledge on breastfeeding, and they're kind of dipping into their own personal experiences sometimes. And like Dr. Lefort, she mentioned that there was only 1 hour of lecture. That was, she was talking about several years ago. But maybe very recently they started to kind of include a little more about it. But the curriculum and the educational framework hasn't really involved a lot of in-depth understanding of breastfeeding and its mechanics and its dynamics. There's a human interaction and dynamics that is also needed to be, included, which is not a part of the study because it becomes very clinical when it has to become clinical. So lactation and breastfeeding isn't just about clinical understanding. It's a lot about human interactions, human dynamics, right? So those aspects are missing. Those aspects are missing, and it becomes very clinical. And it took me a while to actually get the grasp of understanding that the medical community didn't know about it, until I became an IBCLC myself and started interacting with them and said, oh my goodness, there's absolutely zero knowledge about any understanding about lactation and breastfeeding. Other than the fact that there is promotion of lactation, breastfeeding across the world now in the last maybe about 15 years now, 15, 20 years, when things turned around, and there were lots of organizations that came in, trying to support and promote breastfeeding. But the support just narrows down to the fact that we need to encourage mother to breastfeed. That's about it.
And if it's going,
if it's going well, support them.
Yeah, if it's going well, then great, we're supporting it. But if it's not going well, there's formula.
We don't know what to do. Yeah, we don't know what
to do.
Right.
Well, actually, we had an episode 22, another international episode, Jeanette. We forgot about Professor Amy Brown.
Oh, right.
We were talking before the show started taping. She talked about how for so long, the answer to breastfeeding issues has simply been from the medical community, just give a bottle of formula. And how kind of crazy that is, because in no other bodily system would we treat a failure of, your thyroid, or a failure of, some other part of your body. We wouldn't try to, in any other part of your body, we would try to figure out what's going on and try to help your body make it work. We wouldn't just like substitute, something completely different. So let's talk a little bit more about tongue ties, since the documentary we're talking about, as you mentioned in the beginning, is called Untying Breastfeeding. And as you've mentioned, your baby was found to have a tongue tie, and that's why breastfeeding was so painful for you. And that started your whole passion into learning more about this and helping other women with this issue. Your film interviews professionals from all around the world about what tongue tie is and how not everyone identifies them easily, particularly in the medical community. So can you talk a little bit about what tongue tie is, how we believe it happens when the baby's developing, and why there's such an issue with people not even recognizing tongue tie, or even if it's recognized, being apathetic about doing anything about it. Can you speak a little bit to that?
Right. So you can see that there is multiple layers of, complex, lack of knowledge and lack of understanding and lack of empathy. And so there are so many aspects to it that actually makes it much more difficult as in a case. But if you look at any other clinical issues, if the moment you come to know about this, the moment the knowledge starts to come in, maybe there is a process to kind of just jump into it and learn more about it, and start to implement that across. But I guess it becomes much more difficult in the field of lactation and breastfeeding, especially because they feel it's natural and everything should go okay, and we don't think there's an issue with it. And primarily, all breastfeeding issues are to do with mothers rather than babies.
Right.
Oh, the mother is not making milk and she doesn't know how to position her baby properly, or she doesn't know how to latch her baby properly.
She's
So
too
those are issues.
sensitive. She can't
Or
handle
she's
the
too sensitive.
discomfort. Yeah.
Exactly. And then probably she's having engorgement, or she's having an abscess, or she probably has a plug duct. So these are issues that are constantly being hovered around, and they forget to see the other component, which is also the baby,
Right.
who's using there are different structures that baby's using to kind of remove the milk from the mother's breast and empty the breast that way. So that aspect is being missed out here. So when you talk about what's the tongue tie, the simplistic understanding of that is the tongue as a muscle. Also is, I would call it an organ system, because it has so many different functions that it plays in the human body beyond just feeding.
Sure.
And which is actually that keeps me going in the field, actually more to do with breathing than even just feeding, So when the baby uses the tongue, there is an anchoring that's underneath so if this is the tongue, and there's an anchoring that's naturally there, that's called a frenum. Okay, now that frenum can be tight, short, thick. It can be different variations of presentation of how they are.
And it can be
If
called
that
a
does not allow,
frenulum, because here we call it a
it's called,
frenulum most of the time, right?
yeah, yes, frenum or frenulum,
Yep.
both are okay.
Yep.
And that does not allow, if it doesn't allow the movement and function of the tongue in its most optimal way, then it can be impeding how the function of the tongue is, and therefore the feeding, right? So I often talk about this. So I often say to parents that it's not necessary a baby who has a tongue tie will have a difficulty with feeding. It is one of those functions, and it possibly could. So there was a study that said about 50% of babies who had tongue ties had difficulty in feeding, and 50% didn't have it. So there is still that debate. You see, what happens is, oh, babies can feed with a tongue tie, so therefore it can be called a myth, or you shouldn't be looking into it too much, or these kind of talk also then comes in, because it's one of those functions.
It is, but what I always like to compare, the analogy is walking, right? Suckling, being able to breastfeed or suckle on a bottle, whatever, like any sort of thing, the mouth should be able to do that. That's a normal function, as is walking.
Yes.
We know that some kids cannot walk, but you would never see a child at let's say 2 years old, who could not walk and have the pediatrician say, "That's all right, we'll get her in a wheelchair." Yes, if we need a wheelchair temporarily, but we're gonna go. We might travel to other states and see 25 doctors literally to figure out, why can't my child do it? Do we need surgery? Do we need physical therapy? Is there something going on? And some of those kids end up in a wheelchair, just like some kids will never breastfeed. But to be able to have people just take it as an acceptance of it's not working. All right, well, we'll just do something else. Yeah, we want to feed a baby. But it's
not restoring function. Yeah, exactly. Not restoring function, or not even considering restoring function, is something that is you can call that apathy, like complete resignation to the fact that, oh, this is not working. Or rather, it becomes more moralistic to say, oh, it's okay to kind of bottle feed. It's, why do we have such an issue? Like, it's totally fine. And it becomes somehow normalized to not be at the breast. And that is a journey of a mother when she starts to feel alone in her journey. I must tell you this. There have been so many mothers who have called me in the middle of the night in the last decade of my work. And they would say, I don't want any of my family members to hear me, but I have an issue and I absolutely need to breastfeed my baby. And because even the family is not supporting anymore. You know, if they, maybe they would have, you know, tried taking her to a couple of pediatricians, and they, you know how they are, they're kind of just denying the fact that there is an issue even. And then they start to feel like you're making a big deal of it because you're connecting with other mothers on the internet or reading too much on the Google. So, you know,
Yep.
yeah, I mean, there are so many different levels of denying mothers any support, you know, any
Right.
support. And some of them have been taken away to a psychologist because she's so obsessed with breastfeeding. Can you believe it?
Right.
I mean, being obsessed with breastfeeding is, I mean, like, it's just a normal part of process. And so all she's asking for is, can I be supported for the basic function of being able to nurture my baby at the breast? And that's being denied. So I think there's a huge gap of understanding of that. Yes.
You are a revolutionary. I love it. Like just
I
even just
agree.
even just using the word apathy, like going there is powerful. And it's like we need to do more disrupting in our culture and really
Yes.
call things
Yes.
out when they're not right and say, what are we going to do about it? And call it what it is. And I love that you put that word apathy there because I haven't heard anybody else use it that way for this situation. And I think it really is. I mean, yes, a lot of care providers, including pediatricians, are amazing and they know a lot of things about a lot of things. But in this one little sliver, which is actually kind of a big deal because it's about feeding, even bottle feeding sometimes, even if somebody doesn't
Oh,
want to,
yes.
feeding is
Yeah.
feeding, period. And it can come into play later. Like it can be apathy if you don't care what's happening to this baby, which is hinted at by what the parent is telling you they're experiencing, right?
Right. Right.
It's well, good for you. So, can you also talk about what the difference is between a classic tongue tie and a posterior tongue tie?
Right, right. So we were talking about how the frenum is attaching and giving support to the tongue,
Under the tongue, yep.
Under the tongue, right? So now, if you look at the position at which the frenum can be attached naturally at different places, starting from the tip of the tongue to right at the back of the tongue. So those are different presentations. Now, the classic tongue tie, which some of those medical professionals can recognize or would recognize or at least consider recognizing for a speech issue later on,
Right.
would be a classic tongue tie, which is like at the tip of the tongue, which is like a no-brainer. Like you would see it right there, like
I know,
bang
you're
in there.
like,
Oh,
how do you
something
miss
is
that?
funny. How can you miss that?
But
Even
people
those are
do.
missed out.
I know, yeah.
Yes, they are missed out constantly for breastfeeding. They are constantly breast. So those are ones that are called classic tongue ties. The ones that are presented differently than the classic tongue tie, especially the one that goes deep down and is thick and shiny. Sometimes it looks shiny and white in color, and it's broad as a band. So those are called posterior tightness, posterior restrictions, and these are constantly being missed because like we both already, like we all of us are already agreeing that even a classic tongue tie is missed out in breastfeeding because we feel like, oh, maybe that's not really kind of playing such a big role in how a baby breastfeeds, because some babies with a classic tongue ties breastfeed brilliantly. So that's the human resilience in the body, I guess, that we kind of can adapt to various situations, and some babies just cannot. And so we should be able to acknowledge that. So the ones that are deep down there pose the biggest of the problems in breastfeeding.
Of course,
The posterior ones.
if a child was born with skin attaching two fingers together,
Yeah.
or sometimes two toes, but like
Yeah.
then the parents and the care providers would be like, well, let's get that fixed right away. When you can
Yeah.
use your
Yeah.
hand without all five fingers being separated.
Yeah.
But that piece of skin is pretty consistently, I would say, thought to be, well, let's fix that. But if it's under the tongue attached to a muscle that's important for breathing and eating and talking and catching snowflakes on your tongue and licking, like kissing, like it's an important,
So
like you
many
said, organ
aspects of it.
system.
Yeah.
So I wish,
It's an organ system, yes, and
yeah, I love it.
it's affecting breathing, primarily the breathing aspect of it, and then digestions, sensory integration. Sensory integration plays such a huge role in how, and balance in the body. Just balance in the body is also kind of supported with the tongue. So there are more functions than we have ever seen, and the pieces are coming together in the very, very recent times, and still needs to be researched further because the amount of research that's available in the field is not considered to be a huge evidence yet. But that's another area which I keep talking about in terms of research. People feel like, oh, the level of research that we need is in like a randomized control trial is the only research that will be even considered or even looked into. But we forget that in clinical practice, the first thing that you start to do is make an observation. And that's going to be anecdotal in research terms. But that's the first place anyone will get to, right? So that's the level 4 evidence that you have. So once you start to observe in clinical practice is when we will start to see a pattern, and maybe we'll see a case series that comes up. That becomes a level 3 evidence. So you need to develop right from bottom down, then come up to the level of a randomized control trial.
Although
but when you
I could argue,
exactly.
that having a randomized control trial for tongue tie could be unethical.
Yeah, exactly.
Right. That's the other thing. People can't always use a randomized controlled trial in maternity and pediatrics as the only gold standard that we would accept, because many times it's unethical. And so there's this whole idea of tongue ties. What do we know now? As we've been talking, we know that tongue ties are not taught to the main practitioners in our world, our entire world, that deal with the most babies. We know that breastfeeding in and of itself isn't something, whether there's a tongue tie or not, that is always supported by these medical professionals when something's not going right. So whether or not the issue is a tongue tie, this whole idea of, well, you could just give the baby formula, the straw man arguments that has nothing to do with a woman's desire to breastfeed, it's not, is often used as well. And so we hear this word a lot in the United States. I'm sure you feel similarly, that there's controversy around tongue ties, right? And I hear this from patients all the time when I might mention, you might want to be evaluated by an IBCLC, your baby could possibly have a tongue tie. And they say, well, I know that getting a tongue tie release is controversial. And I always make the joke, no, medically assisted suicide is controversial, right? Tongue ties are not controversial, right? Tongue ties are not controversial for anybody who actually has training and expertise in tongue tie and human lactation. They are not controversial for people who actually.
They're also documented in the Bible, which is a historical document. So it is one historical document that goes back a long way.
So, I mean, I'm sure you have in your practice. I know that Jeanette has. I know that I, as a labor and delivery nurse in the United States, was told outright that I was not allowed to tell a patient that their baby would have a tongue tie. I was not allowed, because that would be considered a diagnosis. And people with babies that had classic ties down to the tip were not told by pediatricians that their baby had a tongue tie. So this is unethical, crazy. So I'm sure you find that, people are coming back to you saying, my pediatrician isn't finding what you're finding. And you mentioned that in your video. So how do you respond in these situations when you have experience and expertise and you feel that this might be an issue, and then the person goes to their pediatrician and then comes back and says, well, they said no? What do you do?
Well, earlier in my journey, but the film was way back then. And this was one of the cases that I shared in the film about the story of Mirabelle, was very, very long time ago. So earlier, it used to be difficult to kind of bring around the thought process. I think what I started to do was kind of just concentrate or focus on empowering the mother and giving her information that allows her to have her own evidence of the difficulties that she was going through. And that's undeniable, because she's watching it and she's feeling it. She knows it. So all that she needs is a context to understand. Now, this is a question. Okay, now I see that the parents are being told by the pediatricians or other medical professionals that baby doesn't have any issue. So if the baby doesn't have an issue, the only question that we need to ask about, how do we have an issue with breastfeeding then? What do we do about it? Now, you say, my baby doesn't have a tongue tie. That's fine. That's fine to say. But now tell me, how can I fix my issue that I'm facing? They don't have an answer for that.
They don't.
So most mothers would go, all I would ask is, okay, if the provider is saying that, the care provider is telling you that the baby doesn't have a tongue tie, that's okay. We can accept that. We just need to have a discussion. We need to know what else can be done to support you to restore your breastfeeding.
Right.
And that's when the mothers would kind of find their own, strength within them to say, oh my God, no, I need to keep investigating my question, my inquiry of why my baby is not able to breastfeed.
I love that.
You're
Helping them
going into
find
a
the
dead
strength
end.
within them.
Exactly, exactly. Find their own strength, because the moment they are clear and they have clarity in life, mothers are the best people who can stand and be the advocate for the babies. And I felt that was a lot easier to do than to actually sit and try and really provide those, maybe a research paper or even have a debate with care providers. I felt that was futile.
Right.
That journey is always futile. My only focus has always been support the mother who has come to you in whatever way it needs to be provided. If she needs support in terms of understanding clinical aspects of it, mention that to her. Let her know about it. How does a normal function work? And how else is it presenting for her? Is she feeling a dragging sensation, or is she feeling like there's a biting sensation? So she's feeling it in her body. So it's not too far away. She doesn't require any medical evidence for her to know exactly what experience that she's going through, right? So providing her the support empowers her to then go back and ask those questions to whoever the care providers are for her. But when you come back to telling me, diagnosis can't be done, I think this is also another issue that's across the world. I feel that the primary care provider for a breastfeeding mother is a lactation consultant.
Oh, yes. So there's so many factors that come into play with diagnosis and semantics and who's allowed to do anything. And it's so good to put it back in the parents' decision making line. I mean, it's their baby, it's their body. And if they can be empowered to think about what they're feeling and go seek help if they need it. And, I see that here in the US too, is some of our colleagues will say, oh, I try to talk to these clients of ours, and they say, well, my pediatrician said it's not a tongue tie, so I guess it's not a tongue tie. And I don't know. I think we all can come up with our own way of saying things to parents, and that evolves over time, right?
Mm-hmm.
But I think there's always going to be some parents who, no matter what we think as a lactation consultant, they're going to just go with what their doctor said. And that's okay. That's their choice,
Yeah.
right? But there's others that are going to be like, okay, wait, they couldn't fix it for me, so maybe I'll do what Yasmin said.
Right. Almost like, okay, that's great that they said there's not a tongue tie. What did they offer to you as a solution? And if their solution was to recommend that you do formula and stop breastfeeding, then if that is what works for your family, great. And if it's not, I'm offering something else that we can look into. Right. Kind of like just highlighting without saying it, like they're giving you a dead end. And and again, this I say it all the time, the give the baby a bottle of formula, what's the big deal, is a straw man argument. Because if you want to formula feed your baby, all the power to you. I'm a proponent of choice in all aspects of life. But if you are someone who desires to breastfeed, your goal is to feed your baby your human milk, whether it be by breast or bottle or SNS or whatever, then our jobs, as you said, the primary care provider of a breastfeeding woman is a lactation consultant. Our jobs as breastfeeding support is to help you meet your breastfeeding goals and to exhaust everything that we can to help you meet those breastfeeding goals. Telling someone to just give a baby a bottle, even of their own milk if they intend to feed the baby at the breast, or to just simply feed the baby formula is a dead end. It's not a solution. It's not a solution if that's not what you desire for your breastfeeding goals. So,
Yep.
Yeah, true. And I feel like we have to stop being apologetic about this situation, because
yes,
there's a constant approach of needing to apologize about defending your evaluation as a lactation consultant, and and that's a huge gap, because the mothers and the families, I think they start to kind of figure out that there's no team behind. You see, they get to see that each one is talking in a different space, and there isn't really a team that's supporting her. The care providers are not together in it, and that's the controversy, and that becomes the controversy. So the controversy brings doubts and confusion in parents' minds, and that needs to be broken down. And that will only begin if lactation consultants stop being apologetic about it, of making evaluations, because being the primary care provider of a breastfeeding mother, I think they are in a full capacity and role to make a breastfeeding diagnosis. And we shouldn't be
Absolutely.
afraid to use those terms, because um, there is this hegemony, about who calls whom what, and what their roles are, and what their area of practice is, or what is the scope of practice.
Right.
Scope of practice is depending on what are they supposed to be providing as care. So if lactation consultants are, educated and knowledgeable to support a mother to restore breastfeeding, and to also look at the dynamics that are playing a role there, whether it's clinical role or whether there could be other issues that may be going on, she's fully equipped to do that. And we have to stop being apologetic about that, and constantly defending and trying to design our language in such ways that 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 deflects the whole conversation, and and takes away the central point of making sure that we're doing the best that we can as care providers for our families or communities. Because this is, I think, the debate always has to be behind the closed doors, and you have a fiery conversations between professionals. That's totally fine, and we should welcome that. And that's another issue, because we are unwilling to sit across the table and actually have discussions. We don't want to talk about it. That's the point. And say, okay, I don't know what the lactation consultant's saying. She doesn't know what she's talking about. Or this kind of conversations are something that we are actually just exposing the breakdown of the care providing system at the back to what we are presenting to our communities. This should be behind doors. And we are fighting a fire, and we shouldn't be showing what our weaknesses are in the system. That should be behind the door. I feel like it's okay to have a debate. It's okay to have questions about evidence, and discussions about research. All of that is fine, but as long as we are willing to be on the same side of the problem and say, okay, let's investigate this together, that's okay. The collaborative effort will only begin when we begin to listen to each other, which is the central part of the film. If you notice,
Yes.
if you peel it down to the central core of the film, it's deeply about, are we listening to each other as human beings?
Perfect.
Everything else will flow after that. But if I'm put on an
Communication is
opposite
key.
side, exactly. If I'm put on the opposite side, I'm always going to be on, a fight, right? There's no collaboration. There's constantly going to be a friction, and there's nothing that's going to come out of friction. It's not going to come out of friction, but it's going to come out of a healthy discussion, a healthy debate that we can have as professionals. And I think it's important to have different points of views. It's okay to have different points of views, because everybody comes from the place of being able to provide the best care for their families. And I believe that even medical professionals who may not have the knowledge also come from the same understanding that they don't want to do harm if they don't understand the subject.
Right, right.
But we need to take it as, maybe I don't understand. I would like to understand. That's the approach. But
Right.
if I start to talk about it like more like a religion and say, I don't believe in it,
Right.
we don't have a starting point.
That happens
We
all
don't
the
have a
time.
starting point.
It does happen all the time. It's
I
funny.
don't
I
believe in tongue
actually,
tie.
yeah, like this whole idea of belief. Thank you for
Yeah.
saying that. I mean, I'm a labor and delivery nurse by, my passion. And I've had doctors tell me before, as the one classic example, I had a patient who was stuck at 10 centimeters for like literally hours. And I came on and I did one move called Walters, and her baby went from, possibly needing a cesarean. They were prepping the OR to, head was on the perineum, and the nurse that was taking care of that patient, who had asked me to come in and assist her, said, you know, that when the doctor came in and said, "Oh my gosh, I didn't realize we were delivering in here. I'm prepping the OR." She said, "Oh, Melissa did spinning babies moves." And he said, "Spinning babies, I don't believe in that." And I just burst out laughing. Like, it's not about belief at this point. There's no religion. The baby's head is on the perineum. What are you not going to believe? That you're still not going to believe this baby's coming out vaginally? Like, it's irrelevant. Your belief is irrelevant. This baby is coming now, so you can put your scalpel away. And I also think that this is kind of getting a little philosophical, but as a nurse, I you know, nurses struggle with this since the beginning of time, with physicians trying to monopolize this idea of a diagnosis. And also, and I'm not a physician basher, I have many very close friends and mentors that are physicians, but the idea of physicians trying to monopolize the idea of a diagnosis, and physicians having this idea that they get to define the scope of practice for different types of practitioners, is political. It is not, it is not philosophical, or, you know, it is not the way it's supposed to be. I mean, as a nurse, I have a scope of practice. I'm licensed in my state, but nursing organizations define my scope of practice, not the American Medical Association, although they are lobbying with lots and lots of money in our country to strip the rights away from other medical professionals. So in the world of lactation, and the international, you know, I forget, it's not IBCLC, IBCL.
International Board of Lactation Consultant Examiners.
Yes, okay, IBCLE.
Yeah.
They
LCE.
are the ones that are LCE. They're the ones that are responsible for defining the scope of practice of a lactation professional, right? And so it's absurd to fight and have friction over that, because if we keep our goal focused, as you said so eloquently, Yasmin, if we keep our goal focused on what are we doing collectively to help this person in this situation with this problem, then it doesn't matter. All of that politics stuff doesn't matter. It's irrelevant.
Yes.
There's a lot of things that can happen during the birth process for babies that can affect the synchronicity of all of these body systems working together, muscular, fascial, connective tissue, all of it. Can you speak a little bit about, just to kind of give our listeners and I, you know, maybe a little tip off, a red flag, if you will, of, oh, wow, that was something that my baby experienced during birth. Maybe that could be contributing to my issue. Could you talk a little bit about that?
Yes. So if you, I think birth has a huge impact on how breastfeeding turns out to be later on. And I feel like predominantly we need to concentrate on that, which is why it makes it much more difficult. But even babies with I just need to kind of just add this in here, that babies who have tongue ties, many of those issues or symptoms that you see with babies are possibly masquerading as tongue ties, but may not necessarily be directly contributing from a function point of view. Maybe anatomically, when you see physically, there could be a tongue tie at different gradations of it, but function is what plays the biggest role in deciding whether or not we intervene with that process of, you know,
function is important,
right?
Sure.
The function is important, and we must be very aware of the fact that the function of the tongue has a lot to do with how the birth process has been. And if you go back to the birthing process of it, there is sometimes natural induction, which happens with the indication of the baby being ready to be born. It is a process that needs to be primarily looked into and supported for mothers and families. But when there's an intervention of induction of labor, you are already starting a roller coaster ride. That is, the rhythm of the labor can change. It's not a natural rhythm, right?
Very so much
when the
so.
Rhythm when the rhythm changes, it can be either too fast or too slow, or it's not really the natural dance, the body in negotiation between the mother and baby, which happens during the labor and birth. So when that changes, when the rhythm changes, the compression forces that are there in the entire body, including the cranium of the baby, changes significantly, either leaving the baby to respond in a, and so this is what I say often, that the nervous system usually responds in a flight or fight, in a situation that can be threatening. But with a baby who is in a birthing process, often chooses the third response, the nervous system, of freeze and shock. The baby cannot fight the situation. The baby cannot, run away from the situation. The baby will have to play the role of being frozen or shocked in the process of what is considered to be either too fast, too quick, too much to process during the process of the birth. And that has an imprint in the nervous system, the nerves of the baby, and the fascial system, and the connective tissue system, and the musculoskeletal system. Every single system is getting impacted because of the compression forces that are there. Sometimes traction forces are there. There could be a drag, and there could be a place where the baby is getting stuck in the birth canal. And that is even though it's a natural process of you having the crevices in the mother's pelvic area, they are ups and downs. It's a landscape. The human body is a landscape, and we forget to see that as a landscape. So that negotiation through which they both are negotiating together through the process is being deviated, and it's not natural anymore. So then we need to use epidural because the mother's going through extreme pain. She's not able to negotiate through the pain. So she needs to be given some medications, and those medications have a direct impact on the nervous system of the baby. And then perhaps the birth might end up, maybe assisted birth, like a forceps or a vacuum. But I can't tell you the amount of shock and trauma in the baby's body when you've negotiated through all these systems.
Yeah, even just the way doctors are trained to assist with the delivery. You're saying traction, pulling on the baby's head as opposed to letting the baby orient their body and shoulders and deliver naturally. Absolutely.
Or forcing or encouraging them to
a
push
very
when she's
vulnerable process. It's a very vulnerable, fragile and process, yet it's a very intense process of labor. And if we deviate from anywhere between supporting rather and intervening, there's a very fine line between how can we support versus how can we intervene. And predominantly when interventions happen, they have a huge impact on what plays a role later on. And especially with assisted births like a vacuum, especially the vacuum, I must tell you this, the entire fascial system in the body, that includes the pelvic diaphragm, the respiratory diaphragm, which is right below your lungs, to the thoracic diaphragms here, the different levels of diaphragms, all of them get pulled up towards the head. So those babies cannot sleep, cannot constantly crying, cannot bring their entire muscular system to bring about the coordination to breastfeed, because breastfeeding dynamics and mechanics are very complex. And they're meant to be complex because that's what's allowing the entire developmental, impetus, if you can call that, to allow the body to kind of grow in a very complex way that allows higher functions of the body to then develop through the infancy and childhood. And if that's not being supported, and breastfeeding then becomes very, very challenging, which is the basic competency of a baby. The basic competency of a baby is to be able to healthily breastfeed. And if that's kind of deviated, we need to look at that. So having a worldview of being a body worker changes the entire aspect of how lactation support can be given.
So in the United States, well, not every state, but in our state, in Massachusetts, if you are a lactation consultant, an international board certified lactation consultant, unless you're also a massage therapist or a nurse or a midwife or a nurse practitioner, a licensed provider, you can't become a craniosacral therapist. So I can't do that as much as I would like to, but Melissa, there's a good idea for your next additional thing. But we have
so
people we refer to. There's not, there's pediatric chiropractors. There's some craniosacral therapists that do babies, not that many, but it's one of those things that I've seen such a revolutionary, profound difference in the babies that I work with, and the parents see it too. And this is why I feel so strongly that it's it's really, really rare that having a tongue tie released in the first few days of life is a good idea. you
Yeah,
know?
exactly.
It's just there's so much else going
There's too
on.
many dynamics going on. So
Yep.
when a baby comes in very young, usually we look at, okay, what's been the birth like? What's been the story of the mother during the pregnancy? Not just the birth, the entire pregnancy. Has she been has there been a lot of intervention during that time? Has she been stressful during the pregnancy? So when we take care of all of those layers, then what happens is that it becomes easier for us to assess how much of a function is it really impeding because of a tongue tie.
Plus,
And
you've
if there
had some
is a
time
tongue
for
tie
the
at all,
milk to increase in
yes,
volume.
all
So
those
there's
things, yes,
and for her to
all those.
heal, and sometimes all those things that you described that happen in labor needed to happen, or they were choices that were made and the parent is happy with
Yes.
those choices. So it's not at all to make people feel guilty that they shouldn't have epidurals and
No,
they
no,
shouldn't,
no.
sometimes those things really
They
do
just
need to
need
happen.
support. That's the
Right.
point.
It's
Right.
Because
They
I
looking
need
at
feel
the
like
support.
history.
actually, I often tell them that, when we link between the birth and the breastfeeding, we feel like there's a huge disconnect in understanding that. I don't have a single mother who really comes to my clinic and says, I know there is an impact from the birth. They often are completely surprised that there has been
Right.
any impact from their birth at all.
Yep.
And somehow this has been so fragmentized, completely fragmentized, and they're not connected together at all. And the only example I tell them is if you've had a fracture,
Mhm.
or the first thing you do is to put the limb in a cast, right? Because the virtue of healing is no movement, especially with a fracture. So you just ensure that it's in a cast and there's hardly any movement for about 6 to 8 weeks. And then once you remove the cast, when the bone has already healed, you realize that there is an impact on the muscular system because of the fact that there was no movement,
Right.
and you already are aware of it, and then you send them off to a physiotherapist because you know that there is an intervention that was required, and we are already aware that the intervention is going to cause some kind of other functional issues, that because of the lack of movement. So we forget that we've had a birth, we needed to do an intervention because there was a medical need for it, which is okay, because most of them are meant to be intentionally life saving as process. So
Right.
if they were used as an intervention, how did we forget there is a lack of continuity of care after?
Right.
Right.
Or
Yeah,
did
as a
we link
childbirth
the two?
educator, I think two
Mm.
things. One is this isn't a judgment call. If an intervention was made because it was medically necessary, then let's just be aware of that and then know that, like you said, we're going to have to get that physical therapist in to help your arm muscle, stop atrophying so you can use your arm functionally again. It's not a judgment call that you were put in a cast. It's not a judgment call. On the flip side, though, many times people undergo or feel coerced or pressured into medical intervention that is not medically necessary, at least in our country, but I know it's a problem in other countries too. And so that's something I also encourage my childbirth ed students to keep in mind, that medical interventions can be life-saving, but they have sequela. They have consequences for better or for worse. And so if they are not medically necessary, if you can avoid them at any cost, that would be in you and your baby's best interest. I also think that as a society, and certainly in the field of medicine, there's a strong history of this. We forget that human babies are sensory human beings.
Yeah.
And so if it would hurt you to get somebody to yank on your head, right, for an extended period of time, minutes at a time, or and it would give you a prick in your neck and a headache. And if you can imagine how it would feel to throw your back out or to throw your shoulder out, and how hard it would be to type and to talk on the phone and to write until you get that massaged out, or the chiropractor, or time to heal, we forget that human babies are sensory beings like us. They can feel pain. And so when I was in nursing school, a mother once asked, when I was on my nursing rotation, the doctor said, you need a vacuum. And the mother said, oh, well, is that going to hurt my baby? And the doctor said, well, I don't know. I've never asked one. And it was, ha, 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 ha. And like that, it was a joke. I understand what he was saying, but, just because the baby can't talk doesn't mean that their bruises and their bumps and their boo-boos aren't painful for them. So just being aware, hey, your baby might be going through some of these extra things because of the birth experience. Let's take that into consideration in the context of healthy body functioning, healthy body feeding, there's nothing wrong with that. We have to stop pretending that babies can't feel pain, can't have headaches, can't
But
get
I think it's
boo-boos.
also like, Melissa, we work with a lot of families that are born, whose babies are born at home, and there was no intervention. And there
Right.
still sometimes can be issues with
Oh, yes,
the
Absolutely.
baby's
absolutely.
body or with the breast.
I've
So it's
seen
not
that
even
too.
always about a
Yeah.
medical
Mhm.
intervention, or it could be
No,
that the
absolutely.
reason you needed the medical intervention was the cause of the baby's tightness in the first place.
Right. If your baby
Right.
is, sunny side up, occiput posterior, and,
Mm.
in a military presentation, with their head flexed back, extended chin, and they're stuck in your birth canal like that for hours and hours, and you end up with an epidural and a failed
Mm.
vacuum and a cesarean,
Yeah.
well, you can't necessarily blame all of those interventions
Right.
for the fact that your baby was stuck.
Yeah.
And
And
maybe that is playing the initial role
yeah.
in, that baby's dysregulation.
So
Most of the time, actually.
go ahead.
So I feel like this is also if there are dentists and other providers who actually do release. I feel like if they are listening into the podcast, it would be great for them to just be aware that when they're taking in babies for procedures, they do need to have a little idea about the history of the baby's birth. And if they've gone through the process of support with a lactation consultant or a body worker, to make sure that they are they are looking at the issue from the perspective of, is the function really impacting coming from a tongue tie?
Right.
And it is surprising to see many of those symptoms are gone even before you even did a release.
Yep.
And which is why I say that if there are issues, let's say there are multiple symptoms where a mother presents when she is having issues with breastfeeding, I can tell you from the practice of being a lactation consultant as well as being a craniosacral practitioner, it gives me a unique view to look at what really matters. And 80% of those symptoms within a case of a lactation issue would fall away before you did the frenotomy.
Yep.
70 to 80% of those symptoms will resolve even before you went in for a frenotomy. And that will be a great timing of frenotomy. I gave a lecture on gold lactation, if you guys are aware of it, because we are all
Yep.
lactation consultants. So the one of those lectures where the topic of the discussion was timing your frenotomy. That is also a very crucial, one level of discussions that we can have about knowing when to do a frenotomy. And is it going to be really helpful? Can we reduce the reattachments that occur later? So if a baby has gone through a vacuum birth, hasn't really had enough resolution of those issues, for example, or a cesarean section, the baby's body is in a state of shock. So when we're working on the fascial system, which is the part of the tongue tie, the connective tissue of the tongue tie, you release the tongue tie without having considered what's gone behind. The body is going to go back to its state of tension because that's what it understands as a muscle memory.
Right.
Yep.
So
And the
if we
baby's
haven't
going to
taken
have
care
even
of
more pain, so they're going to still be
exactly,
upset.
yes. And so the mother, then it's easy for us to say the efficacy of maybe a frenotomy is not really good because we haven't really resolved an issue here.
Exactly.
So there are multiple layers of pieces. So I always set layers for my families when they come in. I ask them to have a pen and paper with them when I discuss things with them, and I let them know that each layer that I'm going to set up for you, you will need to sometimes work with it together, or you need to work individually on each of those layers until the time you come to the point of saying this is absolutely an issue because of a tongue tie, and then we take care of that.
Right.
There could be other issues that could happen later on in life. But being a lactation consultant, I think primarily then we are focusing on to see whether or not this is impacting our current issue of lactation and taking care of that. And sometimes it can be resolved without having to take care of a release necessarily.
And I think so much of the controversy, quote unquote, is that so many families are going straight to some sort of release provider and they're skipping the lactation professional that's had training in tongue tie. They're skipping doing tummy time. They're skipping doing various oral facial activities, I like to call them. They're skipping because they didn't know, or they decided not to do it, the body work. And then they go get the tongue tie released, and then they go to their pediatrician, and they're like, well, did the tongue tie fix everything? And the parents are like, well, no. And they're like, yeah, see, it doesn't work. It wasn't a tongue tie
Yeah.
anyway. And you're like,
Did we tell
right.
you? Did we tell you not to believe in it?
Yeah.
Yes,
Right,
exactly.
right.
Oh,
And I'm like, would you
Yeah.
guys talk to us more often so we can tell you what we're doing now? We're not encouraging parents to go right
Yeah.
away.
So
And
there are
Absolutely.
multiple levels of looking at this from a political point of view. Bringing the organizations together, having a team of care providers that are willing to listen and having healthy discussions. I think all of this goes down to how, in what setup are we growing? We just had a talk 3 days ago, and we were talking about the areas of breastfeeding that we're not talking about is the mothering through breastfeeding,
Right.
and which is the primary motivation for a mother to even breastfeed. She wants to breastfeed a baby. Why? Because the entire aspect of the early parenting comes through her experience, through the bodily contact with the baby, understanding the cues of the baby, understanding the needs of the baby, having an interaction, eye to eye contact with the baby. All that is being missed when you're not being able to kind of restore the breastfeeding. And so therefore, what's going to happen is that the lack of trust that then develops, or rather, we're not restoring that trust that is essential in a human interaction, plays a role later on, not to listen to people, to each other. You see how far impacting that is. That
Yes.
if I'm restoring the relationship between a mother and a baby, you're actually setting up a social fabric of being able to have healthy relationship with each other. If we restore the deep listening skills between human beings, that starts with the restoration of breastfeeding, has a huge impact across lifetime.
that
That's
is a
such a
beautiful
wonderful.
way to end.
Yeah, I was going to say that, and you highlight in your film that the mother and babies are experts, and that all of us supporting them should be listening to them. So again, we've come back to listening, respecting, believing women, and relationship-based care as providers, nurses, doctors, lactation consultants, body workers. Relationship-based care and deep empathetic listening is what we all need to be doing, working together to support parents in meeting their breastfeeding goals. So do you have any last encouraging words for our listeners? Maybe somebody that is listening that isn't feeling heard about their breastfeeding struggles?
Yeah, I think we sometimes, between this debate of parents who are, fallen off or fallen through the cracks and have chosen the way of going towards, either bottle feeding or maybe a pump feeding, sometimes exclusive pump feeding journeys are there. Lots of mothers end up doing that, or maybe completely move away from breastfeeding. In that debate, and setting those mothers into two groups to decide whether they are being a good mother while choosing whatever they chose to be. That is another whole fragmentation we are doing within the community of women together.
Yeah.
So I want to give a special hearing to these mothers who have fallen through the cracks, to know that they are a part of us. And we have that experience of knowing that at different levels we can be unheard, and maybe we didn't hear what her journey was. Maybe
Right.
this was not her choice. And very few mothers, you can see the statistics across the world shows more than 90% of the mothers will initiate breastfeeding in the first few days of life. Now, whether or not that ends up to become 43% or 40% eventually clearly shows that it was not the intention.
Yep.
Right.
So later on to say that, oh yeah, I chose not to breastfeed, I think this is a state of dissociation when too much trauma happens in the body and
That
mind.
makes sense. Yeah.
You see, so you start to kind of find reasons to why that happened, because you can't take the load of the guilt that comes with it.
Right.
And these mothers need more support. I think loving support, to include them as a part of the community and say, it happened because of lack of support around you, not because you didn't intend to do it.
Right.
We shouldn't be putting them in a apologetic situation where they choose to kind of defend their choice because they felt that they needed to do that. and start to say, you know, oh, no, I chose to do this because feeding is more important than breastfeeding. So feeding and somehow feeding the baby is more important. Of course, because the baby is going to be hungry. You can't really be sitting and deciding based on philosophy as to what works and what doesn't.
Right.
Right?
You're
Yeah.
so right.
To feed a hungry baby.
Got time.
So
Yeah.
in that sense, I think we need to take away that, the fragmentation between women and bring them together as one community and say there's a lack of support that's there from care providers and society, and lack of listening that's kind of making us go through these cracks. And so I want to kind of hold them together in the space of empathy. And I want them to be heard, to not think that, you know, if I'm not, if I haven't breastfed my baby, I can't be in the conversation at all. I think we shouldn't leave them out.
No.
Yeah.
Here, yes.
And
here,
that can be so difficult.
for sure. Awesome. Well, I'm excited. I hope your book comes out soon, because you are just a wordsmith, like with your words.
I agree. I love the way you
like,
describe things.
There's a book in there somewhere. But so thank you for coming on our
books,
show today.
Maybe books. Sometimes like I've written those titles down of all the books that I want to write, and I say, oh my God, there are too many titles. I don't know what's going to go in what. But
you have to write the book first.
Itself. Yeah.
Write the book
but
first.
The film, I wanted to say, the film, the film was appreciated and loved across the world, and got 2 international awards. It's received 2 international awards. So I'm very, very grateful for that recognition. And perhaps in the field of lactation, tongue ties, or even just breastfeeding, there hasn't been a film that was made in this subject. There have been a couple of films on the birth, but I don't think there was anything that touched upon these aspects of human experiences. And so that makes it all the more special. And also, what's on the way. I thought I should share this with you all. That what's on the way is we're going to have a whole course of knowledge base that's going to come out of the film, and it can be a series of a course where people can sign up for, like care providers, to understand the different dynamics that play a role in supporting breastfeeding mothers. And then all the knowledge pieces that they need will come in together for them, rather than have to kind of dig into it or ignore it or not be a part of my scope of practice. But I think it's we need to kind of start to collaborate this knowledge and cross-pollinate this knowledge together. So people, whoever is providing care, need to have the entire picture and then concentrate on their specialty that they are kind of concentrating on. So this is on the way. It's still kind of being tinkered, and there's a lot of work that's behind that. So the first is a part of the film. As you watch the film, there will be a series of courses under the film that teaches you aspects about birth, about how marketing has played a role in kind of moving away from breastfeeding, and understanding the cues of knowing what is the international code of milk substitutes. How can we comply to that? Is it only the lactation consultants who need to comply to that, or even a dentist who's providing care for breastfeeding families? How can they be careful about market, industry forces that can play in any industry for that matter, and how they can intervene in the process and deflect the actual care that needs to be provided. That I think it's ethics. I think we're talking about ethics. Yes. So those ethics, how they play a role, that is a part of the film. Then we're looking at breastfeeding grief. How do you understand breastfeeding grief? This is not something that's been discussed about anywhere in the world. Do we even define the depression that the mothers get after birth? Anything to do with breastfeeding at all? And what does it play a role in her sensorial system? So all of these will be separate courses that will be put together as a bundle along with the film. So that's my plan, and that's where it's heading to. The project is heading.
I am looking forward to it. Thank you so much, Effath, Yasmin, for coming on our show. I encourage all of our listeners to go to her website, nourishandnature.in, as in India, nourishandnature.in, and check out your work, and also keep an eye out for this wonderful project. Her documentary is called Untying Breastfeeding, and it is available online to view. So I encourage any lactation professional or even parents to check out that video. Thank you all for listening today. And remember that Babies in Common is a community for you. After all, we all have
Babies in common.
Thank you again.
Awesome.
Take care. Happy New Year.
Yes. Happy New Year to you too. Bye-bye.
Bye-bye.